So we heard a little bit about a post-hoc analysis in the AFFIRM trial. AFFIRM was a post-chemotherapy study of enzalutamide versus placebo. In that study, there was a significant improvement in overall survival with the use of enzalutamide. Dr. Scher presented some post-hoc analysis that suggested that patients who were on baseline or on study corticosteroids during AFFIRM in fact had a worse overall survival, whether they received enzalutamide or whether they did not. Now, what's interesting about this analysis is that almost half of the patients actually were on prednisone, and they basically did not exclude corticosteroids during the trial, which is unusual because we think that, in fact, drugs like prednisone and dexamethasone are, in fact, clinically active in prostate cancer. In fact, we had seen that the prednisone alone arm in the 302 study was associated with almost a 30% PSA response rate. So it's not an inactive agent. That said, they did not control for who received prednisone. Clinicians were allowed to be on a drug like prednisone or dexamethasone at will. And the analysis seemed to suggest that there was a causative relationship, or at least that was the proposed possible cause of the worst survival in the patients who received corticosteroids. My analysis during the discussion was that, in fact, these patients were clearly much sicker. They had a worse performance status in general. They had more visceral metastases. They had more bone pain. They had more bone mets. Every aspect of their baseline characteristics were that they were sicker patients. When you actually enter their baseline characteristics into various nomograms, including the MSKCC nomogram, their survival is clearly inferior. So while it's intriguing that the possibility exists that corticosteroids could in fact contribute to a worse outcome, there was no evidence in the presentation today that to me suggested that that was true. In fact, if anything, there have been 3 studies that have used prednisone in one arm in a randomized trial. 2 of those studies, ASCENT-2 and VITAL-2, which were not addressing the prednisone question, but in fact had prednisone in one of the 2 arms, suggested that prednisone was associated with a better overall survival. So I don't know that we have any evidence at all that corticosteroids have a detrimental effect on their own.